Good afternoon, ladies and gentlemen. My name is Anuj. Uh, Topic for this discussion is CVD burden and preventive medicine. So I'll start with some statistics before getting into the questions around this topic. So CVDs are the leading cause of global mortality and a major contributor to disability. Um, Based on certain studies done earlier, in 2019, CVD was the underlying cause of nearly one-third deaths globally. Over three-quarters of CVD deaths take place in low and middle income countries as well. Out of the 17 million premature deaths under the age of 70 due to non-communicable diseases in 2019, as high as 38% of these were caused by CVDs. Given these alarming stats, it's obviously important to detect CVDs as early as possible so that management with counseling and medication can begin. It goes without saying that CVDs remain one of the leading causes of disease burden in the world. Dr. Wali, sir, do you think India is headed towards resentment and ignorance of CVDs as its symptoms in our daily routine?
Thank you. And yes, I had to acknowledge my deep thanks for getting me on this Bharat Swasthya Mahotsav, especially Mr. Anuj and Sudeep Srivastav. You see, this is the most important forum, and it obviously makes me feel that you have read good amount of material, as you quoted, very genuine statistics. Let me start by making it a little more interesting. I always tell to my patients that God has made heart the most sophisticated organ in our body. It's a very artistic organ. And the peculiarity of the heart is that heart starts beating when we are in the womb of the mother and doesn't take any leave, keeps beating till the last breath of the life. And this is what heart is. And as an individual, we make so many insults to qualify your question. I'm telling you, to make a burden on our life and to the life of others by bringing in too much of three whites, that is sugar, flour, and salt, three bad whites. We pour in lots of sugar, we develop insulin resistance, and whatnot. So, coming to the answer of your question, the resentment is there, and there are reasons to resent. Why should we resent? Because we are a developing economy, a developing nation, and there's a very interesting term called DLY, DALY, Disability Adjusted Life Years. That is the years lost due to a specific disease, which has increased fivefold in younger patients in a country like India. And we are in the midst of a crisis. So your topic chosen for this forum is very, very important. And we are heading towards an epidemic of heart disease. As somebody just now was telling, we have become already nearly diabetic capital of the world. I just overheard in the air. Yes, I know. And according to global burden of disease, as you said, the data is absolutely correct. 24.8% of all deaths in India are due to CVDs. And the mean age in which a heart attack occurs in an Indian is 53 years, which is 10 years before than the developed countries. So therefore, lots of agencies, including UN, have focused attention on these facts, like in countries like India. SDGs is a very good term used in such forum, that Sustainable Development Goals set by United Nations in 2015 and later on also. They call for 1/3 reduction of premature mortality from non-communicable diseases, and in which cardiac diseases are the one of its target. And it also includes diabetes and respiratory disease, obviously, because of pollution. There are reasons why we are talking heart disease in this forum, because youngsters involved in smoking, alcohol abuse, low physical activity, insufficient fruit and vegetable intake. I will elaborate on that. Stress, everyday stress, and substance abuse. So, this is an outline through which we can take our journey further, that diseases of the heart, especially coronary artery disease, when we talk of diseases of the heart, when we say CVD, we basically focus on coronary artery disease or heart attack. So we have to be very careful. You see, we have started losing youngsters walking on the road, CEOs, media anchors, those who were regular for the gym. Sudden deaths have increased, especially at the young age. And the reason for this is probably we are not doing correct form of exercise. Let me clarify why it is not correct. Because in the gym, there are instructors whose focus is on selling their product, or the youngsters whose focus in building their muscles, inspired by film actors and otherwise. So the basic aim going to the gym to train the heart is missing, is still missing. So this is very important to discuss today, and I have my colleague who will elaborate on further questions. My take for this first question is this is a serious issue for our homes, for our youngsters who are eating junk food at the midnight at 2 o'clock or 3 o'clock while their parents are sleeping, and in the next morning they see empty boxes of junk food at the tables, or sometimes not. So this is going to be a very serious disaster in the urban India and also in the rural India where my India lives, majority of India lives, and there also there are reasons for increase in coronary artery disease. Thank you.
Thanks. Mohit, sir, you created one of the largest contemporary registries of heart attack patients. Any findings that you'd like to share?
Thank you so much for this opportunity and very good afternoon to you. Well, I remember 21 years, 22 years when I was in Hopkins, I read in a line that India is going to be the world capital of CVD by 2020. And in 2022, I see that India is already on the second rank. And I'll tell you why it is important for us to understand that why CVD is so relevant to it. For assessing the progress of any country and healthcare system, there are 3 A's that are in. Let's make a note of this. The product and the healthcare system has to be available, has to be accessible, and has to be affordable. Only a system that fulfills these 3 requirements is going to be successful. Now, the challenge here is that we are increasing in our availability. To some extent, the affordability is also increasing, but unfortunately, the availability, accessibility of this healthcare system is still very poor to a majority population. I work in a tertiary care center in the busiest centers of the country, right in the central Delhi only. And what we thought was we collaborated with Harvard University almost 3 years back and started the largest contemporary registry with more than 3,500 patients of acute heart attack only in one center, in single center. Imagine our single center is getting more than 5,000 patients of heart attack. We enrolled all of them. Now, what were the findings? Look at this when we say that we are already developing so fast. Out of these patients, imagine that 50% of these, 25% of these patients were between age of only 18 to 30 years. This is revealing. Heart attack occurring in a patient of only 18 to 35 years. This is very, very surprising. Not only that, 30% of our patients were very young individuals, less than 50 years was their age. Smoking was the highest risk factor in these young individuals. The average delay The average delay of a person of heart attack presenting to a tertiary care hospital, can you believe what was the time period from starting of the symptoms? It was 71 hours. The global recommendation is that a person of heart attack should reach the hospital at least between 2 to 3 to 4 hours. 71 hours is what it took for an average person to reach to our hospital. We also started studying the modalities which they use for transport. Some were driving themselves, some were walking to the hospital, some were taking the bullock cart. This was the state of affairs for the patients who were presenting to the hospital. And then 50% of the patients who presented with heart attack had already 25% of the heart which was destroyed. We did the angioplasty in these patients. We had some level of recovery, but my question was, where are we heading? Have we developed an infrastructure to make our healthcare available to the poorest of the poor, accessible to the population which are living in the periphery? It's not that it's not only accessible to the poor. Sometimes even the rich population, they are also not having access to this. Ignorance was one of the major risk factors. Many of the patients, almost 15% of the patients, thought that their chest pain was only a gastric chest pain. When they reached a primary care center, the doctor there in the primary care center misdiagnosed them, gave them only a ranitidine or a pantoprazole and sent them back home. They had persistent chest pain, presented to the hospital. Their heart was completely damaged. So that is why in these patients, we had revealing findings, which is known as the Norrin's Semi-Indian Registry. We have now 6 papers which are already published in all the international journals. And why this was important was because 14 years back, the CREATE registry, which was done in India, in the same population, showed that these were the state of affairs. And now, even after having large healthcare systems, centers, the state of affairs is only marginally better. So if we want to revamp our healthcare system, more than just modernizing it, we need to use and expand our availability and accessibility to the larger population. We have to replicate these models. And this is what we call as hub and spoke model. We have to create small replicas of the tertiary care hospitals in all the peripheral care setups. And that is how our whole population, iski jagrukta badhani. We have to increase the awareness amongst people. We have to make and educate our doctors as well as our patients that these are the high-risk symptoms that you should seek immediate attention in the healthcare. Nothing is going to work, policies are not going to work until and unless each one of us as a healthcare personnel, we are reaching out to the doctors and the public forums and to the masses to completely transform them. So this is what was the registry all about, that we had more than 3,560 patients and we have used multiple analysis out of it. And I'm telling you, out of, as Sir was very nicely mentioning, besides the contemporary risk factors like smoking, like diabetes, which was present in 30% of the patients, like, dyslipidemia, one of the major risk factors that emerged in our population, especially in the younger population, was psychosocial. I will be sharing these findings later with you as you ask me, and those findings will actually blow you apart. You will be amazed that where and how we are working. So that is why today that awareness has to be.
Thank you so much for sharing that, and thank you for creating such a registry, because the analysis out of this is going to definitely help improve treatment in the future as well. But there's been an interesting thing out of both the responses that I've heard so far, that we've seen CVD in younger patients as well now. Okay. So is it a special trend here, Dr. Wali, that we see that we can do something about?
Yes, I started pointing out in my first answer. The young generation has to be sensitized. When you say something about friends in the home, they are very sensitized. If I talk to my son, I talk about his friend, he is very sensitive about the person I'm talking to him. But if I talk about his heart and his future, And in case somebody's son is smoking, the father talks about smoking, they leave the room. This is the attitude of the young generation. Post-COVID, we are seeing, as my colleague was saying very rightly, that levels of stress have gone very high, and this has changed our behavior. Yesterday evening's single bulletin showed three ladies with abnormal behavior, one out of them slapping a doctor, one fighting at the toll, and the third one also was abnormal behavior. So in one 20-30 minutes news bulletin, if we are seeing this kind of behavior, this definitely tells us what are the undercurrents of stress in our society, and this is serious. Similarly, my teachers have always said, do not talk of your personal experience in such fora, but it is very important what I am telling you. A person came from a village with full-blown myocardial infarction, 23 years, young, healthy man with no family history, non-smoker, normal cholesterol, non-diabetic, blood pressure normal, uric acid normal, no risk factors. And I was surprised that why this man had an MI. This was a couple of years back. And when he became settled and he became all right, I had, because he was from village background, I had sent him for an angiogram, not for his age. But his angiogram was surprisingly normal. Then I sat down with him again and took the detailed history. Why did it happen? Why did he have chest pain? And the history came that young energetic boy went down the well, the motor and pump got erratic. For repair, he alone went down and brought the whole Kirloskar pump up, following which he had a chest pain. The local doctor thought it was a gastritis or something like that. Just consoled him, gave him some treatment, and he continued to have chest pain, which is the normal scenario. And then somebody sent him to me, and then he is now walking normal with normal health. Very importantly, we see certain patterns in young females and young males who have normal coronaries, or they have some other diseases other than atheromatous blocks. Some have abnormal origins of coronary arteries, as we see day to day in our angiograms, once in a while, of course. And then they have arterial diseases. The arterial diseases which we know of the larger arteries, they also happen in the smaller coronary arteries. Some of them are genetically determined. And so it is not a condition that we have to have atheromatous obstruction related to cholesterol and classical coronary artery disease. We can have a muscle coming over the artery, like bridging, myocardial bridging, what we technically call. Lots of females can have coronary problems due to overuse of oral contraceptives. So all this happening then comes in young, hypertension is not detected. I made a survey of a school, good school in Delhi, and in a class of 50, at least one boy was having hypertension. Some of them had history in the family. So we miss out blood pressure. Many doctors do not mind taking blood pressure in each and every patient, which should be a regular practice. So all this said and done, the most important enemy is diabetes. Very paradoxically, diabetes manifests when 30% pancreas is already destroyed. So when someone is aware of diabetes, he has already lost 1/3 of pancreas. Similarly, some diseases like thyroid are undetected. So this is, I'm giving you general perspective. But knowing about the coronary artery disease in young is very important. And you are making a registry. Kerala also had a registry, and they found hypertension was most prevalent cause in young coronary artery patient. And we have typical abdominal obesity and stress, of course. Then one of our colleagues, my colleague working at same hospital where you are working, Dr. Gambhir, had done a very important work on lipoprotein, which is a fraction of our lipids. So ApoB and ApoA1 ratio, this is also disturbed in these patients, and we have to regularly screen them for that. So what I'm trying to stress is that at young age, coronary events can happen. They can happen without alarm. This is most important. And higher suspicion index by all of us as doctors is very important. And they should be properly managed, screened, family history is traced, hypertension controlled. And here I would add something which I have seen in about 48 years of my practice. In a youngster, even when he comes with his father or mother, it is very difficult to convince that he has hypertension. And it's still difficult to convince him to take treatment. So if we ignore hypertension, if we do not convince the youngster that your blood pressure needs to be controlled, 10 years later, it is going to tell over his kidney, and sooner or later, he is going to generate a full-blown cardiac event. So all these things are very important. And in youngsters, as I said, food habits causing a lot of problems, including truncal obesity, which we typically have in India, are very important. And we have to really have a watch over what children are eating. Because one of my teachers taught me when this modern medicine was not that developed, modern cardiology was not developed. It was in 1972 in pathology class. And I still remember her words when she was teaching atherosclerosis. One of her sentence was that the nidus, the seed of the atheromatous plaque, sets in the very early life when one is in the womb of the mother. So this is how the predisposition goes. And if we insult our heart by not disciplining our body, we are going to have the disaster which you are pointing out, coronary artery disease in young adults. It includes women as well.
Thank you. I started the sessions earlier this morning. Dr. Anurag Batra also mentioned about technology being the future of healthcare. And we've seen that kind of a theme in all the presentations we've had today. Dr. Wali, do you see any developments in RPM space besides what we have to offer in the Alivecor?
Alivecor, yeah, I'm grateful for pointing out this. I use Alivecor. They have made a device, ECG device, and by putting it on the body, a layman can record his ECG, transmit it through the mobile phone to the doctor. And once in a while, if one is having acute MI changes, it can reach to the doctor within minutes, not unlike 71 hours patient reaching to the hospital, which is very common in India. We have to be very smart, you see, with the heart, because heart is beating every beat. 3 days back, I had a case. The patient had very severe form of a malignant tachycardia, and that patient was paranoid for not having DC counter shock. The patient probably was in left ventricular failure, and we made him to lie down. He was sitting, I talked to him 10 minutes, and I made him to lie down. He went into frank left ventricular failure, and he was immediately hospitalized. So this is how the system works, like what we call as talwar ki dhar or sword stage. I came across a very good word the acceleration. So yes, I am seeing in future, and what I have felt to see in COVID days, we have demonstrated our skills and speed of treatment without face-to-face confrontation of the patient. And a lot of good has happened in India. I don't know what was happening abroad because we did with a very great speed and we treated majority of patients at home. And at least I can say that I treated a lot of patients at home. Now, a GP remarks from London, and his quote came in New York Times. We are basically witness 10 years of change in 1 week. This is amazing. Yes, this is true. We have done that. Our teachers used to teach us, do not consult a patient on phone. No, it's a good tool today. Patients are getting benefit of consultation. We can see the patient. We can see the patient on video. And many times we can get very good information by seeing the patient. So there's another word which I have just now written while I was having lunch, technonomics. So we have to deliver the technology in a cost-effective method. A technology which is cost-effective is very important, and its delivery is very important. And we have a lot of variables these days. You may be seeing, as somebody was talking about Elon Musk, somebody was talking about brain chip. We have a chip which we can link to the glucometer, and that chip can transfer the blood sugar data to the doctor sitting at a distance. Very important. So these are the technological innovations. Lots of them are very practical. We are connecting our blood pressure instruments through mobile. We are transmitting that data. So this is the era of technology, and we have to really explore this. And somebody was showing a lab bike, mobile bike. This is innovation for the villages. So such things can happen in day-to-day life, and we have to take an advantage. And I salute to the Indian minds, Indian young minds who are brilliant and who can change the future, even in the field of cardiology tomorrow. And I really admire our young generation, IITians and mathematicians, physicists, and young brilliant boys and girls who are giving us insight to enrich our experience and coupling the experience with the newer technology. And smartphones are boon, but sometimes picture is not as rosy in cardiology as it looks, but things will improve. There will be a lot of job changes, there will be new roles to emerge, and I see a good future, especially the topic which we are discussing every day. When we were young doctors, we used to treat MI by, even Lasix was not there, by propping up the patient, by giving him a shot of morphine, sometimes if indicated digoxin, and that's all, oxygen. Today, we are doing cardiac transplants. So the things have moved from that bed with prop up position and oxygen cylinder to the cardiac transplant and many things in between. Government of India has also done a lot good to it. And when Mr. J.P. Nadda was health minister, they have reduced the cost of stents. So I'm talking this because these are all technological innovations, and we are getting benefit of that. And in a city like Delhi, every 1 or 2 kilometers, you have a hospital which can have an angiography. We have other tests, technological innovations, which help us to see the heart beating, echocardiography, to have imaging of the heart, and lot more, which is beyond the scope of covering in this small time. So summing up, I can say, yes, technological innovation in medical field, especially in cardiology, is a big boon. And we are going to see the benefits in the days to come.
We often talk about factors like stress at work. Of course, any studies done in this area?
So I'll talk about something which is very practical and relevant for all. You must listen to this actually. It was 2019, Friday evening at 9 p.m. We were already winding up our cath lab, and I was just about to leave. And suddenly there was chaos outside the lab, and we had a young guy, 24-year-old gentleman, who was brought there to the hospital. He was brought massaged to our cath lab with an extensive form of heart attack, anti-all myocardial infarction. We took him on the table, massage on, he was put on a ventilator. I was asked to operate. I was the cardiologist there. And just smilingly went inside, and everybody was like shouting, and just the chaos was there that we really have to do something for this because it was a literally flat line. I went there and my colleague said that, Mohit, you are just smiling and you are just, I said, we are already working in the worst possible scene. We have to give our best. And we opened up, his main artery was on the intubation and the massage. We opened up that particular artery. We could see the heartbeat which was coming. We could see the blood pressure which came up. And successful operation, we shifted him back. Everything gradually stabilized, but he was still unconscious. The whole night he was monitored. Next day, when I went for my rounds, I was kept updated throughout the night. He was much better, conscious, still with the ventilator. We extubated him. And I started talking to him after a couple of hours. I said that, what is happening? Why did you get a heart attack? He's a non-smoker, non-diabetic, no family history, no other risk factors, still in heart attack. And his parents came. He was a married guy with a child. But his wife didn't come, and I asked that I don't want to talk to you. I want to talk to his wife. But they said, no, you talk to us. I said, no, I want to connect with him and his wife and family. His wife was bought, and I was informed that that guy was on the verge of divorce. I counseled the couple for approximately half an hour, 40 minutes. I took a promise from the wife that, your husband was almost gone. We have saved him. This is the only chance he has. I'm going to see this guy only when you hold his hand and bring him to my OPD. She said, yes, I will do that. And I said, promise today that small differences are not going to destroy your life. This young child, only 1 year old, where are you guys heading? Think about this. They all promised, hugged each other. And today, my dear gentlemen, it's almost 3 years down the lane. The child has grown into a big child. Both of them come walking, smiling to my OPD, and they are doing very, very fine. This is what we need today in our life. This is how I started experimenting and studying the genetics of young people. What I did, I tell. We started measuring their DNA telomere length. Just like there is a cap on the shoelace, there is a cap on the DNA also. And what does happen is that cap goes down with the age, and hence as we age, the disease expression increases. So we included all the young heart attack 18 to 35 years in our study. And we measured their psychosocial stress and we measured their genetic level. What were the results? Now listen. Their body age was 18 to 30 years. But when we measured their genetic level, you would be surprised in this published study, their genetic age was equal to a person of 60 to 85 years. Their genes were completely destroyed. The second question that came to my mind is, why is this happening? Mohit, you must investigate it. The single factor that was responsible in these young people, they had highest level of psychosocial stress, anger, irritation, hatred, jealousy, competition, criticism, expectations, everything massively prevalent. Then I said, how does it matter even if it is prevalent? We went into the deeper details and we saw that lack of love, lack of purpose in life, lack of gratitude in life, lack of happiness in relations, that is responsible enzyme called telomerase, and that decreases the telomere length and makes the disease express much faster. When we taught meditation to these people, lifestyle modification to these people, you would be surprised that their genetic length started increasing gradually. My dear friends, this is the point I want to make, that today we are just working and doing a better, not better than what a washerman is doing. वो जो झाड़ू पोछे वाला होता है ना, उससे better a job we are not doing, my dear friends. Why? Because a person comes to Dr. Gupta, he will operate and do angioplasty and say, oh, I'm perfectly fine, a perfect procedure, artery is now flowing. That is not. We are just cleaning the floor, but none of us today is bothered to switch the tap off. The moment we turn the tap off, the disease will start going down and the epidemic will be stopped. And for that, we have to work on our basics. We have to harmonize our science with our ethics and our spiritual self. We have to teach that we are human beings and we are not human doings. We are doing throughout the day. That is very, very important. Similar study by Dr. Robert Waldinger from Harvard University. He again carried out grant and Buick. He said that the single factor that is responsible for a good life and a happy life is good relations. Happy relations in family. That is why it is very, very important. Very, very important. I'll give you a 5-point message as Anuj tells me.
It's quite surprising to hear how genetic age can be.
Yes, it is.
Alarming. So just continuing on with that, preventive medicine is obviously also equally important. Right?
Yes.
Preventive medicine is equally important as well. So anything you would recommend in terms of preventive medicine?
Very simple. Very, very simple. You just keep this, note it down in your pen, in your mobile and anything. Keep it always with you. Just have a simple A, B, C, D, E approach. Nothing more than that. This is what I do for all my patients. A is alert, active, and assured. Every one of you, irrespective of your age. If you are a South Asian or an Indian, you are already at risk. Remember, Indians have a heart attack 10 years earlier, more severe form of disease with different risk factors and very, very poor prognosis. So we are already at risk. So we need to be alert. Second, B, blood pressure control. Measure your blood pressure once in every year if you are a non-hypertensive and frequently if you are a hypertensive. C, cigarette cessation. Stop smoking. Any form of active, passive smoking, tobacco should be immediately stopped. Second C, measure your cholesterol. Once in a year, your cholesterol levels have to be measured, as Dr. Wali very nicely mentioned. It has to be complete cholesterol assessment, complete lipid profile, along with apolipoproteins and lipoprotein A. All these things have to be measured. D, diet. Take care of your diet. Very important. It should be a healthy heart, healthy diet, which I'll share sometime later. Then the second D is very important, is diabetes. Measure your sugar. If you're a diabetic, your numbers have to be set right. And the third D is de-stress yourselves. Every day, 1,440 minutes, my dear friends, you get. Take out 20 minutes to take care of yourself. Self-care is no more a luxury. It's a priority. I end my day with meditation. I start my day every day at 3:30 a.m. with meditation. 3:30 to 4:45 is my morning meditation time, after which I go for my workout. And then the last one is E, that is exercise every day. If I am to summarize exercise in one day, irrespective of your health and a physique, mote hain, patne, it doesn't matter. But if you are not walking for 30 to 45 minutes every day, you are decreasing 30 to 45 minutes of healthy age every day. These are the simple principles, my dear friends, that you have to measure. Jaldi ho, jaldi karo, time nahi hai. These have turned into a virus. Busy ho, jaldi karo, jaldi karo. This is not give and let give this word away from your life, busy. I've never let this word busy associate with me. I transform and change this word busy to be easy in my life. Busy outside, but be easy inside. That's the mantra for self-care. That's the mantra to transform your.
It was amazing. Never heard of a better definition for ABCD. Dr. Wali sir, anything you would like to add on this topic?
I would say that with such a wonderful and wise audience, we can go on talking on the prevention of heart disease. The crux of the matter is, it is known by all, followed by none. So from today onwards, hearing to the nice thoughts of Mohit, and I also profess the same philosophy that we should be loving each other, we should be sleeping adequately. Sleep is also very important. De-stress yourself and do not produce adrenaline unnecessarily. And we do everything to produce adrenaline, starting from driving on the roads till in-house. Many patients, I ask their wives, does he shout? 80% of them says yes. So what we are doing, we are burning our heart, we are burning the telomeres, we are burning our age. The second message is, as far as it is possible, keep your children away from smoking. This is a bigger disaster coming up. And drinks, alcohol, all this added to Mohit's talk would make it complete message that heart is the decent organ in the body. Let us promise today that for everyone, we will be nice, we will be decent, we will love the humankind, and will live long for sure. Thank you.
I can see your time is up here.
Yeah.
Go ahead, sir.
The method of teaching is rudimentary. They teach it from the book, which are 21 The same book is being repeated even now. They teach it from about heart. They will grasp it, I mean, from the book they will tell us it is heart. By showing arrow, it is heartbeat. It is not functioning. I mean, instead of that, if 3D animation is used, we are having this shown that how it is for artists.
Yeah, in the more contemporary teachings now, sir, in most of the hospitals, we have tried to revamp the program.
But then we wanted, करते हैं ये हार्ट में हार्ट काम कैसे काम करते हैं कोप में मार हार्ट तो आप वीडियो से दिखाएंगे तो पता लगेगा I would just need to you maybe also attend some direct teaching to students and I think just following this introduce just the management to do that.
A suggestion, wise suggestion, short 30 seconds addition to that. You are absolutely right, sir. Sometimes we can't animate the nature, but our medical teaching has deteriorated very much. Our generation was a little more fortunate to have good teachers and who have inculcated beyond the knowledge of the book and those arrows, good sanskars in us, and that we are trying to emulate and share with our students. You very well said this side of the first edition, and I wish tomorrow's young medical graduate should learn from teachers and great medical eminent leaders like Dr. B.C. Roy and so on, if not at least their seniors, to inculcate good mannerism, good bedside manners, and a positive thinking and hard-working nature, and above all, being a nice human being beyond a doctor. Thank you.
And my last line with which I'll end, and please आप इस चीज को आत्मसात करिएगा कि दोस्तों किसी ने बहुत सुंदर कहा है कि हर जज्बात को जिंदगी में जुबान नहीं मिलती, हर आरज़ू को जिंदगी में दुआ नहीं मिलती, मुस्कुराहट बनाए रखो तो दुनिया साफ है, आंसुओं को तो आंखों में भी पनाह नहीं मिलती। तो दोस्तों जितना हमने जीवन के अंदर सामान बटोरा है, मैं आपको केवल यही वर्ड बोल के जाऊंगा कि थोड़ा सा सामान तो हमने बटोरा, लेकिन अब सुकून बटोरने का टाइम है। अगर हम सुकून बटोरेंगे तो शायद जिंदगी हमारी अच्छी चले और जिंदगी में हम खुशी और आनंद का अनुभव करें। बहुत बहुत शुक्रिया।
That was lovely. Thank you so much, Dr. Wali sir.
I will thank you, Swami Mohit Anand. I am inspired. Thank you.
Thank you.
Thank you, business world.